Hello again. England's remaining COVID restrictions are being lifted from tomorrow, including the legal requirement to self-isolate. The World Health Organization's special envoy for COVID-19, that's Dr. David Nabarro, is with us now. Hello to you, Doctor. It's always great to see you. Thank you for joining us. Has the government gone too far in lifting all of these restrictions?
I think that actually I'm quite impressed by really what's happening, because there is real stress on continued prudence in the face of the virus. And that is what's going to be needed to live with the COVID and prevent it from coming back and causing trouble. It's going to be a bumpy journey moving from where we were to where we need to be. And I do urge everybody to remember that this virus is still around. It can surge, sometimes dramatically. So do what you can to prevent transmitting it to others, especially if you feel unwell. If you're not required to isolate, I still encourage you to do so. I also encourage you to protect people who are at risk, older people and people with diseases. But perhaps most importantly, because this virus surges, do prepare for the probability that it will surge again. But overall, we have to get on with life. We have to live with it. And perhaps we do have to learn to do it without restrictions from on high. We've just got to do it working amongst ourselves.
And what about dropping testing? Is that a good idea?
Well, I must say that I've believed in the British approach to testing being really right at the front end of what needs to be done. I mean, I know people who've had lateral flow tests and been able to check their COVID status before they go to work every day. People who've used their COVID checks to see whether they're infected before they go to social events. And it really has been useful at reducing the risk. So I do hope that people can still access tests, and that those who really need them and can't afford them will not be prevented from doing so.
If we don't have testing, how do you find new variants?
That's very difficult. I think that one of the good pieces of news that I read from the UK is that there is a plan to continue the surveillance systems that have been used to pick up new variants. And you can't actually check for a variant on lateral flow testing. But if you've got a well-organized set of laboratories that are doing further analysis of test samples from people around the country, that helps you pick them up. So, yes, testing. I mean, if there's not testing, it's very difficult to take the UK strategy to its limits. And I suppose I'm hopeful that the people who can't afford tests will still be able to get them.
But people are not going to go for a PCR test, are they, unless they think that they have got COVID? And the way to have done that previously was with these lateral flow tests. So the only way, I'm guessing, that we'll pick it up is through random testing for people who are travelling.
I think it will be random testing for people who are travelling. It'll be more people coming into hospital in a particular area and picked up with their COVID there. It may be GPs sounding the alarm because they see more people being ill in their surgeries, or it may be just a lot of absenteeism for people, because you do still feel pretty rotten when you get COVID. So absenteeism in schools or in workplaces. Without testing of the kind that Britain has had, it's much harder. You know, the virus is the problem, people are the solution. If you want to solve the problem, you need to know where the virus is. And so your question about free testing, I know it's government policy, but my approach would be to try to keep the tests being available, particularly for those who can't afford them, particularly for those who are at risk, like security staff, people working in public transport, and of course, health workers.
And what would you do about passenger locator forms, Doctor? I mean, they've been a pain at the best of times for people, and it's been questionable how effective they have been. And yet, despite all of the other sanctions and regulations being lifted, restrictions, they're still in place.
Yes, I noticed that too. You use passenger locator forms in case there is a person with COVID picked up on a flight and you want to find the other passengers to get hold of them quickly. They're quite a useful part of the process of tracing where people are when they're ill. I'd certainly expect them to continue, but that's why I also favour maintaining capacity for contact tracing when you do get a cluster of cases. As a disease outbreak drops and the numbers of cases reduce, so it becomes more and more important to be able to do the detective work so that if you are getting some cases appearing, you can quickly pinpoint where they're coming from. So these kinds of things like passenger locator forms or contact tracing systems are particularly useful in the downward slope of an outbreak curve. Sorry for being technical.
That's okay, but I mean, we'd only know if there was a cluster of cases if people were poorly enough to either go to the doctor or to find themselves in hospital. Is that not right?
That's right. So there are parts of what's happening in not just the UK, but in many countries that are leaving me wondering a bit why they're making these decisions. The basic situation is that as you emerge from a nasty pandemic or outbreak, the emergence is always bumpy. It's always difficult. And people are incredibly frustrated and want to get on with their lives. Governments want to get people moving forward and the economic recovery in place. But it's during that time that you really do need to know what's going on. So I suppose if I had a magic wand and I wasn't worried about what the Treasury would say, I would try to maintain things like free testing just through this period until the number of cases really is down. Because if you don't know where the virus is, if you don't know who's ill, if you don't know which parts of the country have got surges, it's super difficult for people to make informed choices, which is what I understand the UK government and other European governments are asking their people to do.